Blog Talk Radio.
Choices, decisions, frustrations, and pain. Knowing I'm going to forget her someday. While I still can, I'll challenge all my loved ones, every friend, to look inside their hearts and understand that I will love them. I will love them while I still can.
Well, hello, everyone, and welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm the founder of Alzheimer's Speaks, which is an advocacy-based company providing multiple platforms to shift our dementia care culture from crisis to comfort around the world. We believe by joining forces and sharing knowledge and just having those everyday conversations about life with dementia that we can remove the stigmas attached to memory loss and those that care for them. We want to give people in the trenches their lives back and let them live with purpose. And together, we can help have that conversation and get that true understanding of what the needs of this disease are, not just the myths and the stigmas that stagnate us. At our core, we believe collaboratively we can win this battle against dementia. And I know we're making a difference thanks to all of you, all of our followers who like us and tweet us and share these radio episodes along with the blog and the resource directory, and have been joining Dementia Chats, which is our webinar series where we interview people that have dementia. They are our experts. Just by doing those little things make a huge difference, because Dr. Oz and ShareCare recognized Alzheimer's Speaks as the #1 influencer online for Alzheimer's disease. And again, that is about all of us working together as one to raise awareness. So I thank you from the bottom of my heart for being part of that. And if you have a moment now just to go ahead and like and share us, that would be wonderful, because the power of one joined together is just a massive, massive effort. So today's show is going to be a fantastic one. We have some very interesting guests with us, and it's all going to be about engagement and awakening and just taking things to the next level. But before I introduce our guests, I do want to remind you all that you can join in this conversation at any time by utilizing the chat box. Just go ahead and type your question or comment in the box. I'll be monitoring those as the show proceeds. Or you can always call in live, and that number is 714-364-4757. That's 714-364-4757, and we would love to hear what you have to say. I also want to just make a couple of announcements. I want to thank Alzheimer's Disease International for working with us. They're just a fabulous organization. And if you are looking for an Alzheimer's organization anywhere in the world, ADI is the place to go, because they are the association for all associations. And you can get to them by just going to www.alz.co.uk. And I also want to do a shout-out to Coro Health, and that's CORO Health. And they are your music prescription. It's therapeutic music that heals, inspires, and supports. And I'll be having them on the show coming up in May. And they're doing some really cool things and have a new app out as well that makes their music therapy very, very mobile. And Coral Health, if you want to check them out before the show, is at COROhealth.com. That's www.coralhealth.com. Both organizations are just doing some very, very, very fun things. Again, I don't know if Rick Phelps will be with us or not. Rick has early onset Alzheimer's disease, and he is the founder of Memory People, which is a closed group on Facebook. But if Rick pops in, I will definitely pull him into the conversation as well. And the last announcement I want to make is just we did have a Dementia Chats, which is our webinar series that we do twice a month yesterday. And if you want to see the archive session of that, just go to alzheimerspeaks.com and look for the blog on the right-hand side, and you'll see the scrolls of various postings. But also the Dementia Chats is listed right there, and you can get a link to that. Very interesting conversations that we had with people living with dementia, and basically we were talking about how relationships change. And so, again, lots of great resources on alzheimerspeaks.com. So let me go ahead and introduce our guest here. We'll get this show rolling. Maria Reyes is a registered nurse who has worked over 8 years in long-term care with Ecumen, working directly with the Awakening program since it commenced in 2010. She's has extensive experience with behavioral assessments and management and a residential care coordination, with memory care being her specialty since 2005. And she is a Level 2 Certified Healing Touch International student. And so, Maria, I just want to welcome you to the show today. How are you doing, Maria?
Good morning. Thank you. I'm well. Thank you for having me.
Wonderful. I'm going to go ahead and introduce Shelley, and then we'll go ahead and start our conversation and hear what you two are up to. Shelley Matthes is an RN, and she is certified in gerontology. She's worked in, excuse me. Shelley has worked in long-term care for over 20 years, and she has been a quality improvement nurse with Ecumen since 2004. And she's the director of quality improvement for the past 2 years. And so, Shelley, welcome to the show today. How are you?
I'm great. Thanks, Lori. Thank you for having us.
Wonderful. I'm really excited to hear about this program called the Awakenings Program. And so I'm going to go ahead and throw this to Maria first. And Maria, what motivated you guys to do this program in the first place?
That is a great question, and you know, all great ideas start with all great things start with a great idea, and that's in essence what occurred. One of our sites in Sunrise is in Two Harbors. The team there decided that looking at the medications that the clients were taking, reducing any potentially unnecessary medications could possibly increase the quality of life for these clients. So they began their pilot program in reducing these medications, and surprisingly enough, what they discovered was that a lot of the target behaviors that were being identified as the causative reason for utilizing these medications were still there after the medications were removed. So that really gave us some insight as to the use of the medications and how necessary they really were.
Okay. And Shelley, is there anything that you wanted to add to that?
Yeah, well, the nursing homes are pretty heavily regulated, and the Centers for Medicare and Medicaid Services, CMS, has for many years been encouraging the decrease of medications, particularly antipsychotics, and that in the last few years, the few years before this started, it was in 2009 that Ecumen Scenic Shores began their program. They one of our nurses actually attended an in-service about the dangers of antipsychotics. And, as nurses, we always want to do what's best for our patients. And, if we go back 20 years when I was a nursing assistant, restraints were a big part of care. And as a nursing assistant, when I would tie people into their chair, I certainly did it because I thought I was protecting them, that I was doing the best for them. And the same goes with these antipsychotic medications that we've been giving folks with dementia, because we thought that they were improving their quality of life. But what we found out was that they weren't improving their quality of life. They were actually just muting their personalities. They were muting things within their lives. And once Ecumen Scenic Shores started removing them, they saw that people started to become more alive and more engaged. And that's where the Awakenings title came from, that it was like people were awakened from the stupor. And at the time, Ecumen, the Department of Human Services here in Minnesota has a wonderful program. It's the acronym is PIP. It's a Performance Incentive Payment Program. So if you develop a quality improvement program, you can receive an addition to your daily rates in nursing homes. So it comes off as a grant, but it provides extra funds then to implement these programs for quality improvement. And in 2010, we were awarded a PIP grant for the Awakenings program for 15 of our skilled nursing facilities here in Minnesota. And that's what started it. In 2009 with Ecumen Scenic Shores, they had such remarkable results. They were able to eliminate all the antipsychotics within their organization. They reduced their antidepressants by over 30%, and people were feeling good. And we had just remarkable stories, personal stories of family members who their mother recognized them and was starting to speak to them. We increased our restorative program, so in order to engage the residents and improve their functional abilities, and the place just came alive. And the rest of us, because we have 17 skilled nursing facilities here in Minnesota, Ecumen does, and we saw that, well, of course, that's the best thing to do. That's the right thing to do. And it just takes a little bit of a culture change in order to implement it.
Yeah, it's an interesting process because you think of so many things here in the U.S. especially. We are so used to just give me a pill and make it go away, looking for that quick fix. But, you guys had mentioned the masking of things, and to think of a community that's gotten rid of all antipsychotics, that's incredible. That's absolutely incredible. In doing that, were you able to still, because I know this is going to be a question on people's mind, were you still able to maintain the same client base, or with that philosophy, did some of your clients have to move out because of a need for medications at all?
No, that actually we were able to maintain the client base. We certainly didn't do it all by ourselves. We've had a wonderful collaboration with the medical community. Dr. Tracy Tomac, who's a geriatric psychiatrist, she was practicing in Duluth at the time when the program began, and she's still a huge part of she's part of our steering committee, and is a wonderful resource for us. But we needed to have that support. There are alternatives, and really, this certainly isn't a cure for dementia, but it does improve the quality of life of our clients. So we teach ourselves we change our behavior, and that's been the biggest part of it. The caregiver has to change their behavior. The person with dementia isn't going to change, but we find out personal things about those people that allow them to, typically behaviors are an external reaction to an internal problem. So that's what our staff have become very good detectives at determining what is the problem. If somebody is having a bad day or a bad moment, we need to investigate and find out what is the cause of that, and then do something that we find improves that situation for them.
Well, and I think that's a really good point, because we love terming things as behaviors when it doesn't fit our immediate need, because it's all about us. And if we're really going to be person-centered, it can't be all about us. It really needs to be about the person that we're caring for. And so as simple as that mindset you think would be to make in this industry, it's a big, huge shift. for people to come to, don't you think? And I'll throw
absolutely.
that to Maria.
Yep.
Mm-hmm.
Oh, absolutely. I believe that has probably been the most difficult aspect of the program is the culture change that goes along with it. We are creatures of habit by nature, and it's about identifying different ways of doing things.
Yeah. How have families responded? Because that's a big shift too. I mean, just because of family dynamics. So you can go in and kind of tell staff, this is your job, this is what you have to do. But it's, with families, not so much. They kind of have their roles, and there's not written job descriptions. How did they feel about the program? And Shelley, I'll let you go ahead and take this one.
Yeah, that's the hard part, is because we're all kind of wired to believe what our physician says, and if the physician orders a medication, then they must need to have that. And that was hard for people to let go of. It took a lot of education and convincing in the beginning. And not that, and what I should say is that the physicians they're certainly not pushing these antipsychotics, but when the nursing home or the nurse calls and says, I don't know what to do with this person because they're acting out, or they're very agitated, or they're upset, and the physician's natural inclination then is to help out, and so they prescribe a medication. And most people, family members too, believe that, they need that to keep going. So being able to gently educate, and then of course seeing the results, that's what's been so motivating. And they're all personal to the family member and to each individual staff member. The experiences that they've had are just so heartwarming and remarkable. We have dozens and dozens of stories that we've archived and share with amongst ourselves that really keeps people going. But we had a news presentation. Care 11 out of Minneapolis a couple years ago did a story, and they focused on the family members, and that was the most incredible thing. Every time I watch it, and I've seen it many times, it always brings tears to your eyes because it is so remarkable. And that's where we have to put ourselves as professional caregivers. It's in the family's place because that's their loved one, and we try to treat everyone as if they were ours, and they are ours.
Well, that's a nice, respectful way to look at it, that you're part of the family, not replacing the family, but just another addition to that family support system. Because I think sometimes there can be dynamics and stuff that come into play there. I should probably back up and have you, when you guys went for this grant, I'm sure there was a lot of excitement, seeing what was happening up in Two Harbors, and decided to go for the grant money. Maria, can you talk to Ecumen's visions and expectations to move this forward?
Yeah. Well, the leaders at Ecumen believe that there was a better way than medications to treat many of the people who are our customers. So, although the culture in our society is accepting the use of medications such as psychotropic medications to help calm people with behavioral mood symptoms, our leaders really wanted to provide an individualized care that recognized each person's individuality, their dignity, and self-worth. So we discovered through this programming that there are many, many other ways besides medications that can actually decrease, that can increase the quality of life when used in frail. That medications can decrease the quality of life for frail clients. So I think the Ecumen's vision really kind of correlates and goes hand in hand with the vision and the expectations of the Awakenings program.
Okay. Shelley, anything that you want to add to that?
Yeah, well, there was a touch and go it was about 6 months before we learned whether or not we were going to be approved for the grant. And at the time we decided we have to do this. It doesn't matter. Regardless of whether the increase comes, it's the right thing to do. And so all of the wheels were put into motion, irrespective of whether we we got the grant or not. And part of the cost, of course, was the training, and that was the biggest part. And it's ongoing because, with staff turnover and new people coming in and out, training is ongoing. And then we started a very robust restorative program, so that replaces we don't have people sitting around in chairs. They have good exercise programs. They're individualized to the client and what their functional abilities are. But getting people moving and walking and active, our activities program increased significantly. And then we needed a specific a champion. We had Awakenings champion, or we call them project leads, at each site that really tracks how we do this, because it had to be methodical. You can't just wipe out their medications immediately. And as new people come into our buildings, and unfortunately it's a constant stream. Typically, folks don't come into nursing homes until family has done all they can at home. And by that time, they've really probably built up quite a large cachet of medications that they come in with. So, the program never ends. It keeps going.
Okay, and that's a good point. I think that's really interesting in terms of, I never really thought of it in that light of people at home probably, do have a lot more medications just because, they don't have the variables of staff to switch out roles and, trying to maintain things and trying to preserve things. And, again, having that attitude of the doctor always knows best. And if this is what he's saying that I need to do, then this is the lead we're going to take. I know with my parents, my dad's since passed and my mom's 85 and in the nursing home, but their attitude was always whatever the doctor said was what they were going to do. They just really rarely questioned, what came out of any doctor's mouth, because there was such a high level of respect for them. And, I'm in my mid-50s, and I still have a high level of respect for the profession. But, I don't have a problem questioning and asking why or how and, some of the details versus just taking it and go. And I think that's one of the benefits in terms of a community like Ecumen is saying, hey, maybe there are better ways. And the fund saving from getting people off those psychotropic meds, those are expensive little buggers too. So there's got to be. Has there been any research in terms of cost savings from a pharmacological side for patients at all?
Yeah, well, we're working on getting more, verifiable data, but our self-reported data, and of course we had outcome measures with the PIP program. Our outcome goals were to improve our quality indicators, quality indicators. Minnesota has those for all of our nursing homes, and people can see them on the Minnesota report card or 5-star rating. But our goal was to improve our quality indicator for antipsychotics without a psychosis diagnosis by 20% over the 3 years. And actually, after year one, we had improved it by 97%. So we hit our goal. Yeah. Now the goal is to keep that momentum and maintain it, because the quality indicators are updated every 3 months, every quarter they're updated. So we're still way up there. We're the average. It's run on a point system, and we're the average points across the state of Minnesota for that particular indicator would be 59.9. Ecumen is at 87.9. So that's the difference just within our organization. But when we look at the medication eliminations and reductions we've had, and this is just averaging it out, at the end of June of last year, we'd had over 800 medication reductions or eliminations. And atypical antipsychotics, which are the ones that are most commonly prescribed for elderly clients with dementia, are your Zyprexas and Risperdal and Seroquel. They have just become generic in the last half a year, so the price has come down on them somewhat. But at the time, they ran from $275 to over $450 a month. So when you multiply that by those 800 reductions, we are saving over $200,000 to $350,000 a month just on those medications alone, which is charged back to either the client or Medicare, Medicaid.
Yeah, that's an incredible number. And when you look at the numbers of people with dementia, why we are not putting more money into these types of programs, I know that we don't have the lobbyists that the pharma does necessarily, but it's huge. It's absolutely massive. And, part of my belief, too, is if we can get people off the drugs and really know what the true symptoms are of this disease, then it's going to be easier for the researchers to zone in on a cure, because right now it's so wide and spread, and we've got so many things, like you said, masking the true issues out there. Maria, I'm going to have you talk to us a little bit about how the organization implemented the program. If you can kind of give us a step-by-step process of how you decided to switch this out and do your training and kind of what it looked like as you were going.
Mm-hmm. Well, our first step was really identifying leadership within each site, people who believed in the changes that were coming, that there was a different way of delivering the care. And we worked with these particular, what we call project leads in each facility, trained them extensively along with the administrators and the directors of nursing, because we were expecting a facility-wide culture change. So it wasn't just a nursing department movement, it was an entire department movement. So it did take everyone from every department to be on board. And once we identified the people who were really going to continue to infuse that energy and keep pretty much the elephant on the road, we began our education. And the education and the resources that we provided to each facility came from a number of places. We worked with with many different professionals to bring us education for us. For example, we identified with the Patient Safety Advisory from Pennsylvania, the Patient Safety Authority, and even though the material is a little outdated, it helps staff understand that medications are tolerated differently by the elderly as they are, than we tolerate them. So it gives them an idea of what's, acceptable dosing on our elderly clients versus younger clients. Looking at alternative care plan interventions was another area of education, and we utilized a lot of some evidence-based products from the Hartford Center for Geriatric Nursing Excellence. Got some materials from them, along with Jolene Brackey. She has some DVDs in her website that we utilize to help the line staff understand just different ways of interacting and managing out-of-character episodes when they do occur. So education, was I call it the second step, but in reality is a step that continues throughout and always through the programming, because we began educating our staff members within the facility, but then we extended the education out to families and into physicians, because we found that if our physicians were on board with what we were doing, it was going to be a lot easier to get them to ask those questions. What have you tried? Prior to now. Can you tell me more about the symptoms and so forth, and really increasing that thought process that medication should not be your first choice. So along with the education came engaging all the key experts and the consultants. Again, like Shelley had mentioned, we were very fortunate to have Dr. Tracy Tomac, a psychiatrist currently with the Regents Hospital in St. Paul, Minnesota, as one of our team members, and she began to teach our physicians about different ways of using medications, because, psychiatrists who simply, that prescribe medication, it's a little different when people have the behavioral psychology in that field of study and expertise behind it. So our physicians were able to learn from that. Engaging family members was another key step in ensuring that the program was successful, because as you had mentioned earlier, there is a fear factor associated with the unknown. And if your loved one has always been under the influence of a medication, because in your mind and in the history behind it is that was the right thing to do, the person wasn't perhaps exhibiting those behaviors that either the family sometimes finds more distressing than the clients themselves, it's scary to just think about, what is my loved one going to be without this medication? And so engaging families, building trust, because they needed to be reassured, and they needed to understand that if the medication reduction or discontinuation proved to be in any way less than a positive effect for the client, if they had a less quality of life because of the lack of medication, that we would definitely bring it back. And sometimes it was a matter of reducing it, and they did better on a lower dose instead of completely being off the medication. But it was kind of building a relationship between the client's family and ourselves, so that they knew that we were all working together towards this end result. And really just an ongoing support of the programming. And it, like I said, education, it continues to grow today, and we continue to bring experts into the field, into our organization, to speak to our staff about different ways of managing these episodes and learning new ways about medications, identifying with delirium. And in essence, that is the program. It's a lot of education.
Okay, well, wonderful. I'm just going to do a shout-out to our audience again. If you have any questions or comments, please feel free to use the chat box, or you can call in live at 714-364-4757. That's 714-364-4757. We would love to hear your thoughts on this. I just find it absolutely not only fascinating but exciting and so long overdue, because being on this journey myself with my mom for 30 years, the stigmas have been hard and fast in terms of how can you engage people. And when we've got them, drugged up, it's pretty hard to engage them, to control them. And it's been very interesting for me as an individual, not only as a daughter, but just to watch this disease. It's really brought home the fact how much influence I have on somebody else by how I act, and that I can really change the environment and the energy level and all of those types of things. Not with drugs, not with alcohol, but just by how I choose to interact with someone. And it sounds like your program really helps in terms of making those connections as well. Would you say that's accurate, Shelley?
Oh, absolutely. That's exactly right. And, when people lose their short-term memory in dementia, and that's what we're trying to teach our staff, they don't want to behave differently, but they have a lot of fear. So if you don't remember where you are, you may react. Your fear may come across as striking out, or if I came up to you and you don't know who I am that morning and just and not aggressively, but I'm going to help you get dressed, that would scare you. And many times we pass that off as that's their, I'm doing air quotes here, that's their behavior. And that's not a behavior, that's a natural reaction to fear. So our approach is absolutely paramount to how they are going to react. And if somebody, we've learned a lot over the last several years. But if someone is looking, we have to get to wherever they are. We need to go where the resident is, where the person with dementia is. We can't try to pull them into our world, and we shouldn't. But there can be wonderful things to find in their world. So, for example, if they're looking for their children, they're probably, in their mind, they're in their 20s. They're a young mother. So there's nothing, years ago we had reality orientation. I'd say 15 years ago when I was working as a nurse manager, we were told to, bring people back to, if they said, I'm looking for my husband, and if we were supposed to bring them to reality. No, your husband died 3 years ago. Oh, my God, what a horrible thing for that person to experience moment after moment, because she'd forget, maybe in a half hour, mm-hmm. but then she'd want to know where he was again, and we'd try to bring her back. And again, and I looking back now, it's awful that we put people through that, but we thought we were doing what was best for them. But when we know better, we do better. And Maya Angelou said that, and we use it all the time because we know better now. We know that these drugs really don't improve the patient's experience or the resident with dementia's experience. We know that it can actually harm them. So when we know better, we should be doing better. And reality orientation doesn't work. We need to go where they are. And you're right, it's mm-hmm. all about how we behave. We have all the control over how they are going to experience life.
Well, one of my training, equations that I use when I go out and speak is getting people to really understand that a person with dementia reacts exactly the same way the rest of us do. They use the exact same formula. It's just being processed different, and that formula is their current attitude plus their past experiences equal their perceptions. Wherever they are in time and place is their perception, and that perception then triggers the reaction. And when we don't like the reaction, then we label it a behavior and say, you know what, you're not fitting into my world real good right now, so you have to change. And like you ladies said, they can't change. They don't have that skill set to be able to do that anymore. So, we really have to just put on those detective hats because there is a reason for the reaction if we would just slow down and pay attention. And I think that's probably one of the most difficult things that I see when I go out and do training is getting people to slow down and not be so task-oriented, because we've always pushed people to be very task-oriented. This is what you have to do, boom, 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 boom. And really you have to start shifting to being truly that person-centered, formula that you're talking about. And that takes, that just doesn't happen overnight. It's something that has to be practiced, and it has, it's almost a skill that has to be unlearned and relearned again in a different fashion. You're still getting the task done, but you're learning to be more spontaneous in terms of maybe how it's delivered, and not as judgmental and more in the moment, with that person. And it's a big culture change and a very, very interesting process. What I'm going to throw this back to Maria again. What have been the most difficult aspects of implementing the program? Maria?
Yeah, I think it's the culture. It's the culture change, along with knowing how to be proactive in behavior management. It's really given them the tools necessary to really look at the client with their eyes, to listen with their eyes, as I say, and to identify how they can infuse an intervention proactively to reduce the behavior. Wondering is an excellent it's an excellent example to use when a client begins to so-called wander. They're looking for something. So when the caregiver sees this, it's a great time to start intervening by trying to figure out what are we looking for and how we can get in their reality and try to give them a moment of serenity by just validating that what they're looking for, maybe it's their children, maybe they're at school, and making things okay. instead of past practice would be to wait until this wondering has escalated to a place where the client's really trying. Now they're distressed and they really need to find what they're looking for. And by then it's really too late to really try to bring that person back. So I think that is probably one of the most challenging aspects of education that I've encountered in working with staff is really how do you provide that toolbox for each individual staff member who already brings their own set of skills into the workplace, and some, with different backgrounds. It's an individualized educational process for each culture, and each facility has a different culture. So because of the variations in that and the training needs, I believe that to be the most challenging aspect.
Okay, there's a comment. Nurse Pam is saying reality orientation to me was a form of abuse. She said, I used to use my technique back then, and I was written up for this. Today, what I try to do now is just consider the right thing to do. And, there's the saying that when you've seen one person with Alzheimer's or dementia, you've seen one person with Alzheimer's and dementia. And I think that also is one of the difficult things in terms of training, is that you really have to be spontaneous. You really have to have a toolkit when approaching this, because every individual person with the disease is different, but so is every care partner. And then you mix those together, and then you put them in different environments, and it's constantly mixing and shifting and shaking, and it is about doing the right thing. One of the other tools that I have used is called Your Memory Chip, and I don't know if you ladies have heard about it, but it's just a real simple thing to get people off that kind of list of things to do, and it gets people focused on three simple things. Is the person safe? Are they happy? And are they pain-free? And to me, one of the biggest shifts for me as a daughter was to understand that it wasn't about right or wrong. It wasn't really about set routines, though they're definitely helpful, but it was really about, if I'm going to be person-centered, it was really about, is this person calm? Are they happy? Are they peaceful? Because that was really the service that I decided that I wanted to deliver, not only when I'm training, but with individuals that I know, like my mom, and love. At the core, that's all I really want for her, is to be calm and safe and happy. She's been in her end stages for 4 years, so she can't really tell me what she wants, but I try to put myself in her shoes, and that's what I would want, to be treated with dignity and to be peaceful, because so many times, we would mention the wandering and the pacing or the repetitiveness. It's all that anxiousness that's inside them, and so getting to the core of what's causing that. Shelley, did you have anything else that you wanted to add in terms of difficult aspects of getting this program off the ground and continuing?
Yeah, well, leadership buy-in certainly was and continues to be a big part of it, because if the leadership in the facility isn't supportive of, so let's say someone is supposed to have a bath today, our task-oriented staff want to get their jobs done, but it might not be the right time. Leadership has to make sure that they make it okay for everyone to give that individualized care that you spoke of. And I just wanted to comment on Nurse Pam. I think that's wonderful that she had the foresight way back when, because it really was a different time, and we get better and better as time goes by, I believe. Certainly I think we're not the only ones with these kinds of attitudes, certainly, but the more and more it catches on, I see things, as you said, Lori, things are going to have to change. We're going to have to start putting our money where the benefits are, because right now there's no known cure, there's no known treatment, and there's no known prevention for Alzheimer's dementia. There's nothing right now. But so we have to live with what we have, and make the best of the situation. But we do need to be advocates and make sure that the research continues, and not just these, the stopgaps, which I think some of these answers with medications that aren't effective, that they do mute people, and maybe make it easier for those that are around them, but it doesn't make it better for the client themselves.
And I agree with you. I'm not anti-pharma by any stretch, but I truly believe that we have to, as a society, as a world, we have to learn how to live with this disease. We've done that with heart disease and diabetes and AIDS and cancer and everything else, and we have to remove the fear. We have to start having these conversations. I mean, that's one of the reasons I started Alzheimer's Speaks, was just to try to get people comfortable having the conversation about what's it really like, what are the true needs, because otherwise we're just a bunch of professionals running around guessing, and we need to hear and see and talk to people and get ideas, and we need to get creative. We've got to break down those silos and use them differently, repurpose things. And that's one of the things personally I love about my job, is being able to connect people all around the world with all these different unique approaches. And as wonderful as the Awakenings program is, or the Memory Cafe, it doesn't mean that the next guy has to do it exactly the same, but make a change and develop something that's going to work for your setting. And, I think by sharing the information and sharing the ideas is so empowering. I hear that from people all the time, that it's like, I didn't look at it like that. I didn't think of it like that. Or, well, if they can do that, I bet we could do that. We could try that. And, again, removing that whole fear of change itself. Ecumen had to have a very strong stance to take on a challenge like this, because there is the risk of failure anytime you make a change, and then to go in with after grant money, and you have to prove it and substantiate it. You have to really look at those things closely. But I think when we're guided by the heart and the soul of, like what Nurse Pam said, of doing the right thing, it becomes much easier. And the fear of, well, maybe I don't have it perfect, and realizing that perfect doesn't matter. It's about progression, because what I was hearing from both of you is that, the system that you've got developed, I mean, you're constantly in there training and tweaking and doing things, because, there's staff turnover, the residents change, and I'm sure you've learned new things as you've progressed through this disease. Any comments on that, Maria?
I absolutely agree. There is a constant need for education and bringing new ways of thinking, and that's the wonderful thing about this program, is that what it is today wasn't what it was initially. So it has grown into what it is today. And I really like to say that the Awakenings program is more than a program. It really is a way of caring. It's a way of going through the process of the nursing process in a different way, and really utilizing our nursing scope of practice and coming up with those non-pharmacological interventions that we can. We just have to tap in there and look for it.
Shelley, anything that you want to add?
Well, she's absolutely right. We are constantly morphing, and our next venture is Ecumen has 43 assisted living facilities within Minnesota, and we're also branching out to other parts of the country. And assisted living, as our plan had always been to start with our skilled nursing facilities and then move the philosophies of Awakenings into our memory care units of our housing. And so that is happening. Maria's hard at work creating that and getting information out to our housing sites. But just as a preliminary, we started gathering data. And, of course, folks in housing come from their homes typically. They don't need any kind of nursing care, but usually they've also gotten to a point at home where it's become too difficult to be alone. The use of antipsychotic and other psychotropic medications in folks in housing was just dwarfed what we were using in skilled nursing facilities, and that was a big shocker to me. But that's what I said, that now I'm starting to realize. I mean, people do what they can at home, and they do their best to manage. But same thing, it's everywhere. So I would imagine that there are people in their homes that are loaded up as well. And again, there certainly is a place for medications when they help, but what we found is that many times they're not giving us the relief that the person with dementia needs.
Very true. And again, a lot of times, you see this not just with dementia, but in all different cases where you go to one doctor and they give you a pill, you go to another doctor, you get another pill, and people talk about that all the time where, no one really knows all of the pills you're on except the pharmacist, and most people aren't asking the pharmacist, hey, do these guys get along in my system or not?
Right.
And so very, very important stuff to be looking at. And, the pills so many times are easier to take than, maybe going out for a walk and doing some exercise or changing our eating habits. And I can say I'm guilty as charged myself. I'm not a pill taker, but I probably don't take as many actions to improve my lifestyle or my body as I should. Do I need to walk that talk a little bit better for myself in and of itself there. In terms of the Awakenings program, can either of you speak to maybe comments from staff and how they have felt about this program? And Maria, I'll throw this to you first.
Mm-hmm. Yes, I think, just like any other person, myself included, the program has been, it's work. It's hard work. It's not easy. It does call for more staff, observation time, assessment time, initially getting to know the client, what works, what doesn't work. But in time when most staff members really come out with the aha moment when they actually see the results of their work. Stories and testimonials about clients who had, perhaps not been verbal at all of a sudden begin to interact with them and say good morning or smile. Things like that. Those are the moments that really make all the work rewarding, and they see that. But initially, was there resistance with the thought process of it? Absolutely. Anytime there's change in a culture that's, as you had suggested earlier, and I have to agree from being a nursing assistant myself, task-orientated work, now going to person-centered approach, it is a shift, and not everyone can make those shifts easily. So there's resistance with change, but like I said, if the leadership sticks with the actual vision and supports the staff through whatever, usually people, when they have difficulties coming to a place, is because they need more information or tools to get there. It's a lack of insider education, and once they have those things, they can move forward with it.
Mm-hmm. Yeah, one of the things that I found in terms of shifting culture change from kind of that task to person-centered is what I do is I call it emotional-based training, where I get them to feel the need for change. And, I always talk about, for me, I didn't wear a seatbelt for years. We didn't have to, when I was growing up. And then, my daughter went to school and was taught, you wear your seatbelt. And from her nagging, I felt the pain, to wear my seatbelt and to do things differently. And I think it's all about kind of that storytelling and sharing those just precious connections that happen, and empowering staff in terms of being able to make some different choices and having input. I think that's one of the beauties of going to this type of program, is it really can light the staff on fire in terms of, well, what if we try this? Or how about if we try this with this person? Or I heard family, and all of a sudden they're sharing these moments that we didn't know about before, and then getting the families to share that personal history and engage can make so much difference too. Shelley, do you guys do kind of a patient history with families to help employees engage?
Yes, you bet. The more detail, the better. Because, again, when you get into their place, you need to know what the details are. You need to know what their best friend's name was when they were in high school. Those are, tools that you can use to get people into a place. And what we say is, it isn't all about the whole day. It's about creating those moments of peace and serenity and happiness. And many moments like that are put together, create a really great day. We found that laughter, and I don't know where I heard this research, but apparently laughter releases endorphins of happiness that last 20 minutes. So if you can get people to laugh every 20 minutes, you have a pretty good day. But having those details, knowing where people are, make a huge difference. And then knowing what doesn't work is also good, and having a good, effective way of communicating from, shift to shift and staff person to staff person is really important. Maria's got a whole list of tools, and, we know what some of the tells are. I mean, and the staff that work day to day with people, they really know what their tell is. They know if they start tapping their foot that means something specifically, and they can hurry and intervene before things escalate, as, with the example she gave with wandering.
Yeah, it's just unbelievable when you're able to share, when you're able to laugh. I mean, it's going to be much better for staff wanting to go into a place where they feel it's fun. Versus they're stressed out and not sure they're doing their job right, or not having that engagement. That's why people stay, in their positions when they're happy, and you can just do so much for so many by role modeling that too. I found where my mom is at, and I would imagine that that this has happened in your communities as well. But when you've got somebody who is engaging somebody, others are watching, and they're learning new techniques without a word being said about training. It's just kind of that osmosis thing where they're like, oh, look at that, I can try that, and then all of a sudden I'm seeing somebody, another family member or even a staff member, maybe trying a technique that I just used, with my mom or with somebody else. In the facility, and it's just, and all of a sudden the conversations start of why are you doing this, and how did this happen, and just the benefits, and that open communication is so beneficial on so many different levels, and it just allows, when I walk into a community like Ecumen, you can just feel, kind of I don't want to say. Freedom's not the right word, but it's this comfort, and it's this power of connectiveness that isn't in all communities, and it's not in all families, it's not in all settings, and it is something that has to be learned and nurtured and embraced, and to have that power in leadership, because you're right, if you don't have the right leadership, you're in big trouble. To be able to pull that off, because you've got to have that consistent cord there. Well, I can't believe our hour has just flown by so quickly here. Maria, is there anything else that you want to add to the conversation?
Not specifically. I think we've covered a lot of information. I mean, there's a lot more to cover, of course, but just really excited that you had us today on your show. Thank you so much. It's an honor and a pleasure to share what we're doing.
Well, great. Shelley, anything that you would like to add?
Yeah, same here. I'm so thrilled that you had us on today, and it did fly by. We were a little nervous early this morning, but it went very good. It was very painless. Thank you so much, Lori. And we hope to have actually we're going to be launching a new website that will have a lot more information about awakenings through Ecumen very shortly. But we do have handouts available just on the steps that Maria went through. just to give an overview of the program if anyone is interested.
Well, that's wonderful. And they can go to Ecumen.com, and that's www.ecumen.org. Or you can also email Maria, and her email address is on the radio page there as well. But it's mariareyes, MARIAREYES @ecumen.org. And we are going to, I'll be putting the episode on Alzheimer's Speaks blog, and we'll be putting a link so that you can get directly to that PDF about awakenings. And then I would love it, ladies, if you can let me know when your new site is up on this. If you want to submit an article to Alzheimer's Speaks blog, we'd love to push that out. I think this is an absolutely fabulous program, and it would be wonderful to see it expand all around the world and people really take this in and embrace this. So wonderful work that you're doing, and I thank you each for taking the time that you have today to be on the show.
Well, thank you. Thank you so much, Lori.
Okay.
Thank you.
Have a wonderful day. I'm going to go ahead and introduce our next guest here, and I'm just thrilled to have John with us today. This is going to be just kind of a fun topic. I had met what they call the Llama group about a year and a half ago, and they are this group that is just so ignited to make a shift and to make a change in our dementia care culture. Now, John Kopic is the Community Outreach Coordinator for Lakewood Health Systems and Psychiatric Services. And Lakewood's Reflections program provides psychiatric services for adults that are the age 55 and over. And for the past 10 years, he has been working with aging services and older adults in central Minnesota. And he is one of the founding members of LAMA. So I'm going to go ahead and pull John into the program. How are you doing, John?
I'm very good, Lori. Can you hear me okay?
I can hear you just fine. I'm going to start out and ask you, what does LAMA stand for?
That's a good question, and everybody asks us that. It's actually the Lakes Area Memory Awareness Advocates. And we found that LAMA is a lot easier to say and a lot easier to remember than that.
Well, and it's so cute because when I get the emails, there's always a llama, somewhere in the email, it seems like, too. So it just kind of makes me chuckle. I have been so impressed with your group. Can you tell us how you got started in terms of this mission of shifting our dementia care culture in central Minnesota?
Oh, absolutely. We only need to go back probably about 3 years or so. I was doing community development work in, north central Minnesota, and I got a call from the Alzheimer's Association, and they wanted to start a presence in the Brainerd Lakes area. And so after a couple discussions with them, we called a meeting in Brainerd, and we invited senior service providers in the area and just began to talk about this, what we saw as a lack of services, lack of information about Alzheimer's and memory loss. And out of that, the group was amazing. I think we had about 12 people show up, and we began to decide who do we need in this group if we're going to go out and tell the Brainerd Lakes area about memory loss, Alzheimer's, dementia. And names just started coming forward, and all of a sudden we began to meet monthly. And kind of one thing led to another. We developed a vision and a mission. We decided that basically we're going to go out and kind of be the educational piece that we can for the Alzheimer's Association in the Brainerd Lakes area.
Wonderful. Well, I know I was at your conference last year, and I see these emails zipping back and forth, and I've just never seen so much energy. I mean, before I open up the email, it almost feels like it's going to blow up my computer because there's just so much excitement on what all you guys are doing. and the speed at which you're pulling things together and working together as a team, I just find very, very fun and very, very exciting. Now, you've got a forum coming up this year. Can you tell us a little bit about that?
Sure. The mission that we have at LLAMA is we want to create dementia-competent communities, and we want to do that by informing the public, and we want to do that to help increase knowledge and awareness. And so what we've done the last 2 years, and this will be our third year, is we've put together a forum, and this year's forum is entitled Dementia, Family, Community, and Professionals Doing It Right. And we offer this in Brainerd, and we've put together quite a cast of characters that are coming together to deliver information to folks on May 21st.
And that's going to be held at the Central Lakes College in Brainerd, if I'm not mistaken?
Central Lakes College in Brainerd. They're one of our partners. We have a number of partners throughout the region, and they're the host site for us. We've been there the last 2 years. It's a good place for us. And if anybody's listening that actually tried to get there last year, there was some road construction, made it a little difficult to actually get to the forum. The road's completed. The road is wonderful. There's no problems with road construction this year.
Yeah, I was there last year, and it was like I thought, I'm going round and round, and it's like, okay, there's got to be an inn here someplace. So that's nice that that's gone. Now, Verna is also with us. Can you introduce Verna to our group?
I certainly can. Verna Tenyon is the Aging Services Coordinator in Todd County, and I've known Verna a number of years. Verna's kind of instrumental in getting a group from Todd County to come over to our forums. Verna, can you hear me okay?
Yes, I can.
Well,
what else did I
Verna.
say about you?
Yes, I can hear you well.
Verna, is there anything else that you wanted to add regarding your introduction at all?
Not really. I'm really delighted just to be a part of this conference and get this information out to people. And I'm really glad to have Todd County, area extended. We are served quite strongly by the Lakewood Health System, and so I believe it is really imperative that we get that information into our entire county.
And what are you seeing from the needs in terms of your county members? Is this something that people are really grappling for, information on dementia?
The very first training that I hosted in the area, we had almost 80 people attend. We had no room to seat them anymore. And that's when we decided that we really needed to be more aware of what was happening. And so each year we host a conference or a training that has to do, at least in part, with memory loss and dementia, some of the aspects that people need to talk. And we talk about caregiving a lot. This year we're actually doing a brain fair to be developed in Bertha, Minnesota in August.
Okay. Wonderful. Well, that's exciting. I think that's fantastic. And the needs are just so massive no matter where you live in this world. And to think that you had 80 people show up and we're running out of space for your first one, that just, says that the community needs and wants this information so badly.
I know I met Verna a number of years ago, and we worked on a bundled services program for Todd County, in which not only would the senior get a meal, but also they might get some library books or some other information. Somehow we're trying to put all services together that we could get to that person rather than just a one-time drop-off of a meal. Verna, that program's been pretty successful.
It has been very successful. In fact, as we're actually looking at trying to expand the ability to serve surrounding counties, we have the ability, the skill, and the past track record. We could probably serve about 5 kitchens or 5 counties with our service if we get it off the ground. So that's what we're working on in Todd County.
Wonderful.
And so when we began LLAMA, Verna was kind of a logical pick to be part of the group because of her experience in Todd County and working with the senior centers in Todd County. So she's been a pretty valuable member for us in terms of getting people involved with the services we provide.
Oh, that's wonderful. And it really it takes a team to be able to pull things together. It truly does. None of us can do this alone, and I think that's one of the things that I find so exciting about your group is the way you all work together is just absolutely incredible. I mean, there's just this real sense of the greater good and making a difference, and it's very fun to be part of, and I'm thrilled to be coming up and speaking to your group again this week, or not this week, but next month here. Can you tell us, John, a little bit about who should attend the forum?
Well, sure, and we talked about that at length, when we want to put the forum together, and, the idea was that, well, this should probably be for, I'll say spouses of those affected with dementia, but we wanted to go more than that, too. A big part of it is for professionals working in aging services or mental health. And then, again, one of the audiences we're really trying to reach would be the sons and daughters of those folks that have dementia or recently diagnosed with Alzheimer's. I think it's really important for those folks to get information about that, because one of the things we keep finding is that, Alzheimer's is not only a kind of a scary word, but it's really misunderstood.
Verna, anything that you want to add to that?
I think that's very important, and I think what I'm seeing as I work longer in this area is that there is a huge amount of caregiver burnout of all ages, and many of the caregivers are working, and it's really hard for them to glean that information, so to have it all compressed into one day is a really good way to reach the public.
Mm-hmm. Yeah, it's a nice flow. I think you've got a nice variety, too. John, can you tell us a little bit about the educational activities that are going to be part of this forum? What can people expect at this forum?
Certainly. The forum is really pretty exciting this year. We have a little different format. We're going basically a full day. And, it starts out, we have a keynote speaker, Jacqueline Herron, and she's an author. She authored the book Singing Solo in Search of a Voice for Mom. So we have a person that has written extensively about her journey, her personal journey with Alzheimer's, and we're kind of looking forward to that. One of the other breakout sessions, we have Gwen Zazelski from the Alzheimer's Association, and she's going to kind of give us that, the 10 warning signs, the Alzheimer's Basics 101. And again, we find that's really valuable because people that come to this, they're at all kinds of different stages in their journey with their loved one with Alzheimer's. They may just be on the front end, just having gotten the diagnosis, or they may have been living with someone for years with a diagnosis and still not knowing what to do. So Gwen's talk about the warning signs and the 101, that's good for everybody to have. We also have Deb Richmond, who's from the Alzheimer's Association. She's going to talk about learning the language, communication, and memory loss. And again, as we work with families, families get so frustrated with their loved one as they don't understand, and they keep asking, why does mom always ask me, what time it is, or why does she keep repeating this stuff, or why do they keep repeating the same stories over and over? And so this piece is really important because it lets people know that, the communication that they're getting, that's part of the disease. It's not mom, trying to get their goat or mom being mad or anything. It's just the way mom is. So I think that's really important for folks to be able to grab that. Later on in the day, we've got a panel of experts that are going to show up. We have a caregiver that's going to be there. Her husband's been diagnosed with Alzheimer's, I think, in 2009, and she's going to talk about, parts of that journey, how that's been for her and her daughter. We have a representative from Congressman Rick Nolan's office will be there. Al Doty, he's a former Minnesota representative. He's now working with Congressman Rick Nolan. And Al's mom had Alzheimer's and then passed away from that. So he has some personal experiences he can share there also. We're going to have Dr. Mark Holub, a psychiatrist here at Lakewood Health System. He's been working with older adults, and of course here at Lakewood, our Reflections program, we deal with people 55 or older, and he has much experience with that group. We have Dr. Julie Eggers-Huber, who is our clinical psychologist here. She does a lot of testing in terms of the folks that we get here at Lakewood Health System. Kathy Dobson, Director of Social Services, will be here, kind of talk about how she sees that, and when we have folks in the care center, talk about dealing with the families. And as you know, sometimes that's not as easy as it should be. And then also John Ward, Minnesota House of Representatives, has agreed to be there. So we've got a little bit of diversity in the panel, a lot of different backgrounds. The day is going to finish up. We have a closing keynote, Living Well with Hope. That's kind of nice to kind of end the day, the idea of with hope. And Janet Byland's going to be there, occupational therapy, talk about interventions. And then we'll also have Gwen come back from the Alzheimer's Association to talk about some resources, because that's a big part of what LAMA wants to do. Not only do we want to get information out there, but we want to have resources available locally. And I know one of the big things we try to talk about is we would like someone to be able to call a number and talk to a person and get some answers. It's really frustrating when you call and you get one of those recorded lines, or someone has to give you a couple more numbers, and by that time you're tired. And what we really want to do is be able to put information in people's hands where they get some results fairly quickly.
Wonderful. It'll be a fun day, I think, packed with great information, and I like the new structure that you've put on this. I think the panel will be very, very interesting. And I've heard Deb Richmond speak before, and she just does a great job bringing things home of how we have to change in terms of taking care of people, and the little things that can make a huge, huge difference in terms of our interactions and reducing the stress and those behaviors that we like to call them by just switching how we're providing care, if it's at home or if it's in a community. So I'm excited to be part of that. I'll be talking about becoming dementia friendly and the importance of that, and how we're so all intertwined. We really can't separate the public versus the person with the disease versus the professionals. We have to work as a team because we all have such impact on this whole piece that we're working with. How do people contact you if they want to become part of LAMA?
Well, at the current time, one of the best things to do would be to show up at the forum and get to meet some of the LAMA folks individually. That's a good way to do that. Another one, we actually have a mailing address where people can send us information. To Post Office Box 644 in Brainerd, they can certainly do that. We have a blog, but it's currently kind of being revamped, and so I don't want to send people there and kind of get a dead end. One of the things is trying to get information out. It's a little difficult sometimes because LAMA as an organization, we don't have an office. We don't have a secretary and a phone line there. And so, again, coming to our meetings, that would be a good thing. We meet the second Wednesday of every month. We meet over at Central Lakes College in Brainerd. We go in the business and industry door, and we meet. Usually it's for an hour or more, depending upon how much business we have going on there. But that's currently one of the best ways they can kind of get a hold of us. For the forum, of course, you go to Central Lakes College to the website, and you can register right there if you need to. That's probably the best way right now to become part of the activities that we have going on.
Okay, great. And I think it's a nice way to really see what you guys are all about, is to come to the conference. You'll really get a good feel. So in order to be part of your group, you don't have to necessarily be a commercial entity then. They could be an individual person.
Lori, it's incredible. The folks that are currently, part of LAMA, part of the group. I mean, we've got people from Aiken and Baxter, Brainerd, Crosby, Nisswa, Piers, Staples, even down in St. Cloud. We've got people that show up in Brainerd for our meetings. We have people that work in the field, as myself. We have several individuals who are affected by it because their spouse has a diagnosis of Alzheimer's disease. And again, somebody from off the street could walk in and just be part of the group because they have an interest in the area. So there's no real criteria for it. There's no initiation fee. We don't charge anything. If you show up and are part of our meetings, we certainly aren't going to make you part of a committee and give you any tasks to do. You're free to pick and choose what you want to do.
Wonderful, wonderful. Verna, is there anything else that you'd like to add?
Well, in Todd County, we are actually organizing a bus that will pick up at each of the senior centers in Todd County and take people to this forum. And that information will be coming out in our monthly newsletter, The Echoes, and in our news release that we'll be sending out right away. And so that would be one way in contact in Todd County. It'd be the easiest way, too.
Okay.
And in Todd County, we've been doing this for several years, and with Rainbow Rider, we actually have been able to offer a really low-cost alternative to traveling, and you can go in a group, and then you get to do a little more networking, and which actually helps that progressive, education where people are starting to talk about what's happening in the community.
Oh, that's a wonderful, wonderful way to be able to do this. That's absolutely fantastic. And John, can you tell people how much does it cost to attend the conference?
It's really inexpensive. It's $15, and that covers one day of all of the speakers, everything going on. It includes lunch. We've got vendors there, so there's going to be some handouts. If you are a professional and you want CEUs, the charge is only $50. So that's really pretty reasonable for a full day of information.
Oh, that's very reasonable, and it'll be a fun day. Lots of resources and great energy, and I know you won't be disappointed with the information that you walk away with. And like Verna said, the connections you'll make. Even last year, I saw people connecting. And just, in a couple of the programs that I did, new friends were made just by having these conversations and learning together and, not feeling alone. That's just so huge. If we can remove that isolation and that fear factor that seems to be wrapped in dementia will be a big, big part. Are there other initiatives that you're also planning throughout the year, John, with LAMA?
Yeah, there are, and just to kind of get back to your point about attending that forum also, I had the privilege of doing a couple sessions on Alzheimer's 101. A number of us in the LAMA group have been trained by the Alzheimer's Association to deliver that program, and so I did that a couple of times at the forum last year, and just to see people in the group that I'm presenting to, kind of their faces change as they begin to realize that what they're experiencing is, they don't have to be alone in this. There's other people like that, and it's almost a relief when they come and they hear that there's other people out there and they can talk with others. So that was really important in terms of people part of this. You asked about other things that we do. One of the big things that we do is we will come out and we will speak to your group, your organization. If you've got a coffee club, if you have a Sertoma club, whatever, Elks, whatever it is, we will come out. We kind of tailor a presentation to you. One of the things we like to do is at Alzheimer's 101, we kind of talk about the warning signs, the basics, those kind of things. There's questions and answers throughout that period. As part of our LAMA group, we like to get out and do that, once, twice a month if we can. I know Verna was really good. She sits on a committee for the Conference on Aging here in Staples that occurs every June, and I think they're in about their 32nd year, and they're asking for presenters, and Verna said, hey, we got to do this Alzheimer's 101, so we're set up to speak there. That's the first Wednesday in June here in Staples. That's at Central Lakes College in Staples, so we're going to come out a couple of us and do the Alzheimer's 101. So that's one of the big things that we do. And like I said, I don't want anybody to think that you have to have a huge group. We'll speak to a small group, and we kind of tailor it to your needs. We've been out and we've talked, in the evenings. We've talked in the mornings. It doesn't matter. We'll find somebody to come out and speak with you. The other thing that we're doing is we're putting together a Get the Facts education series, and we're looking at that in the fall. Starting in September, we're going to do that on Tuesday nights in the Brainerd Lakes area, and again, it's going to meet every Tuesday for 4 months, or the first Tuesday of the month for 4 months. And, we're going to do things like the Alzheimer's 101, talk about the basics. We may do something, have kind of the medical perspective, have a doctor, psychiatrist in there talking about the medical perspective. We may try to get Deb Richmond to come up to talk about communications. And, again, it's kind of be an expansion of what we're doing in the forum. But, again, we want to do that in the fall to kind of continue our mission of educating and informing the public.
Great. Well, you guys are doing fantastic work, and I just want to give you all kudos. And I was hoping Corey was going to be able to join us, but she is out in Washington, D.C., if I'm not mistaken, doing advocacy work out there. And, it's just a powerhouse group of people, and it's a privilege to know you all and to be working with you. So I thank you from the bottom of my heart for everything that you're doing. What is there an email or a phone number for the Dementia Forum? Should we give them is the college the one kind of coordinating that for if you want to get tickets?
The best to do is you can call the college directly. That's 218-855-8118. Again, call Central Lakes College in Brainerd, 218-855-8118. You can certainly do that. And you can go to their online registration if you wish to do that. And that's not hard to find either. http://CLCMN.AUGUSOFT.net. So it's Central Lakes College, Minnesota, augustoff.net. And again, if you just go to the Central Lakes College in Brainerd, you can find their website, look under courses, and they'll get you right to the Llama Forum.
Wonderful. Well, thank you both for being part of the show today. Verna, was there any last comments that you want to make?
Well, I'm really excited that you had us on your show. I really was interested in the previous presentation and really respect you for looking at all the ways that people are addressing this disease. And I really appreciate that on your end as well. And this is the kind of thing that we need to get out to the public because Alzheimer's has been something that, or any kind of mental illness has been something that people have hidden for so many years. And I think we need to get it out there and it be something we discuss and we actually work for common good.
Exactly. There's also, I'll just put a plug in for Dementia Chats, is a webinar platform I do twice a month, and that is where I interview people with dementia. And this last session, we talked about changing relationships, and those have been very powerful. I've gotten letters from families, from communities, from doctors, a little bit of everybody saying, I have learned so much from listening to these people who have dementia, answering these questions. And those are all archived, and they're on the Alzheimer's Speaks website. You just have to, when you go there, you'd have to go to the About Us page, and then go down to Become Dementia Friendly. And below the Become Dementia Friendly is the information on the Dementia Chats, and all the archives are there. There's also some video on Becoming Dementia Friendly, one that if you're interested in sharing any of these links, please do so. They're all on YouTube. That's what they're there for. One of the most popular ones that we've had on the Learning to Become Dementia Friendly is one that talks about what it's like to have dementia. And people, the response to that one has just been very exciting because I just give some people some examples that it's not just that somebody forgot their keys and so forth. So feel free to share our resources on AlzheimersSpeaks.com. That's what they're there for. We also have some free tools people can go ahead and register for as well, the radio programs and the blogs, because, again, our goal here is to raise voice of everybody around the world and share information and knowledge. I just think it's the only way to go is to be collaborative and to not be so proprietary that we're locking down the services that are needed. By sharing knowledge, we can all do a much better job and really tweak things and learn so much faster. Is my personal philosophy. So thank you for joining us today, Verna. John, anything else that you want to add?
Hey, Lori, I just really want to invite people to that Dementia Family Community Professionals Doing It Right Forum, May 21st, Central Lakes College in Brainerd. It goes about 8 to 4. Registration opens at 7:30. You can certainly call Central Lakes College in Brainerd for any more details or to register there. And again, it's $15. I think it's the best buy in town that day. A full day of information, lunch. I guarantee when you leave, you'll probably feel a little bit better than when you got there.
Let me ask you this. If there's somebody from out of town, maybe they're in the Twin Cities, but they want to take a drive for a day, would they be welcome?
Absolutely. And, of course, on the 21st of May, it's going to be sunny and at least 75 there in central Minnesota.
Well, my gosh, let's hope so, because they're still talking snow. It's getting old, isn't it?
Yeah, we're tired of it, too.
Wonderful. Well, thank you both again for your time today. I really appreciate all that you are doing and that you took the time today to share with our audience all the cool activities that you're up to shift our dementia care culture. Really appreciate it. So have a blessed day, and we'll see you in May. Okay?
Thank you very much. See you then.
Bye-bye. In wrapping up the show today, I just want to, again, thank Alzheimer's Disease International and to tell people if you're looking for an Alzheimer's Association anywhere in the world, go to ADI, Alzheimer's Disease International, and you will be able to find an association nearest you. Also, Coral Health, again, I'm going to be really excited to have them on the show. I believe it's May 28th they'll be on, and they are your music prescription. That'll be an interesting show because it's going to be about the therapeutic aspects of music and how it heals, inspires, and supports all of us, not just people with dementia, but the effect it has on everybody. But again, we'll be talking specifically how it can be utilized for those with dementia. And if you all wouldn't mind saying a prayer for me, I put in that $1 million idea for St. Paul, Minnesota, to become the first dementia-friendly city. They're going to be picking 30 finalists out of, I think it was 950 ideas that they got. That'll be coming, I think it's May 8th or 9th. They're going to be picking those, and I would love for the dementia-friendly community idea to be one of those finalists and push its way out into the world. I also wanted to mention there's a fantastic video that I posted on my blog that is done by Kathy Greenblatt, and she wrote a book called Love, Loss, and Laughter, and it's 5 minutes of the importance of touch. And it is just so uplifting. It's something you're not going to want to miss. So you can, again, just go to www.alzheimersspeaks.com, and in the right-hand corner, there'll be the blog scroll, and you can see, get to the blog from there and be able to find that video. You can also get to the Dementia Chats recording if you'd like to from that aspect as well. Our next Dementia Chats will be on May 14th. I may have to change the time just because I'm going to be traveling that day. And again, Dementia Chats is where we interview people on a webinar platform where the experts are those with dementia. Our upcoming program, we are going to have on the 3rd Tom and Karen Brenner, who have written a fantastic book on the connection with dementia patients again. And then Ellen Gerst will be talking about grieving. On May 6th, I'm going to have a son who made a video about his dad with dementia, and then author Lisa Hirsch, who wrote the book My Mother, My Hero. And on the 13th, we'll have Linda McLean, who is all about appreciation and gratitude and how do we live with a chronic disease like this and feel grateful? And the second half of the program will be Dr. Daniel Nightingale, who was originally from the UK and now lives in the U.S. and is here to make some big changes in terms of collaboration as well. So, again, I thank you all so much for listening, and if you wouldn't mind, again, pushing that like button or tweeting us out, helping us spread the word, all of those little things have a great impact. Have a wonderful week, and we'll talk soon. Bye now.
Hi, this is Suzanne Newman, host of the Answers for Elders podcast and radio show. We are the North Star that guides you through the complicated journey of senior care with trusted experts in money, law, living solutions, and more. So join us on this station, your favorite podcast channel, or just go to AnswersForElders.com. Meet the Wayshowers who will help your journey go a lot easier.